Over 10 years ago, sinus procedures were not anywhere near what they are today. Today, we have amazing technology that is able to use real-time CAT scans to see exactly where your sinuses are blocked. And we use a small balloon catheter to dilate open the blockage. For patients with mild to moderate sinus blockage, this 15-minute procedure called balloon sinuplasty can be done in the office, as easily as getting a cavity filled by your dentist. No nasal packing is used, and patients can go to work the next day. Two things: accuracy and comfort. With respect to accuracy, we use CAT scan navigation, and that's critical. We use your current CAT scan to know exactly where we are dilating instead of doing the procedure blindly. And the second thing is comfort. If a patient is comfortable, they'll allow you to do a better job. I've been performing balloon dilation sinuplasty in the operating room for over 10 years. When it first came out, we tried it in the office, but it was just too uncomfortable for most patients. Since then, I've developed a painless protocol that has been phenomenal for our practice. We use a great topical numbing spray that completely numbs the nose before we even get started. And then we use our newest technology called Pronox. This is 50% oxygen and 50% nitrous oxide. Essentially, it's laughing gas. The patient holds their own nitrous inhaler and uses it as needed throughout the procedure. The patient is completely in control, and because it's a gas, it's completely out of your system in about 3 minutes. This is important because it makes it completely safe for my patients. Patients are more comfortable allowing me to do a better procedure without the use of narcotics, and they're completely back to normal with no downtime after the procedure. Because it's out of your system in just a few minutes, patients are allowed to drive themselves home the same day.